Today I'm going to be talking about Sherman's kyphosis. Kyphosis is the medical term for a curvature of the spine. It's similar to scoliosis, where scoliosis is a curvature side to side, and kyphosis is a curvature forward to back. The curvature can range anywhere from 65 all the way down to about 45 degrees. The thing that makes Sherman's kyphosis special is that it develops during adolescence, which is also why it's called juvenile kyphosis. And it affects about 5% of the population, so it is a pretty common thing. The exact cause is unknown. They suspect that there's possibility of just some abnormal growing during growth spurts, and most people agree that it is definitely genetic. We see it in families a lot. There is, of course, a lot of people that think that this is just due to poor posture, but most speculate that it is poor posture is a symptom rather than a causation. So the symptoms, pretty much just a rounded upper back with a prominent hump. And since it is occurring in adolescence, the back has time to combat this by pushing out the lower spine, which will give Sherman's kyphosis a signature S shape. So an outward curvature up top and an inward curvature towards the bottom in order to try and straighten out the body. Due to this, there's back pain in pretty much every single case. Some people have mild back pain, and it can get pretty bad for those that have a deeper curve. This is pretty much all muscular pain, and in severe cases, due to the curvature, you will see the thoracic cavity having less space, and therefore you'll have less lung capacity and develop breathing difficulties because of that. Sherman's kyphosis can be pretty impactful. Most prevalent among kids is just the decreased self-confidence and body image issues, just because it is abnormal and does give a, quote, hunchback appearance. The back pain is there, of course, and it does interfere with things, though with treatment, the back pain can be mitigated pretty well. But those with this disease do have to be extra cautious in their daily activities to not worsen it, and can sometimes have to abstain from heavy lifting, sports, and certain jobs because of it. And it is very difficult to maintain good posture when your body is naturally fighting against good posture. There are a number of treatment options. All cases will begin with some form of physical therapy and exercises. Bracing is pretty common when it's caught early enough. And if it continues to grow or gets to the moderate cases section, more intense physical therapy rather than just exercises will take place. And pain management medication is also a possibility, whether that's opioids or muscle relaxers. For the more severe options, surgery is pretty much the only big fix. This is reserved for those that are in severe pain with a significant spinal deformity that is impacting their daily life to the point that correction is necessary. The surgery involves two different parts. There's a anterior section where they will actually open up your chest and start moving discs and placing bone grafts and preparing for the second part. And that is the posterior section. This is when they'll open up your back and actually implement things like rods and screws to kind of straighten the back out and to help hold it in place. So with Sherman's kyphosis, because it is suspected to be genetic, there's not much you can do to prevent this other than making sure that you are getting diagnoses early on. If you have any history of back curvature in your family, even if that didn't necessarily occur during adolescence to your knowledge, it's still good to keep an eye on things and make your doctor aware of that for your kids, so that they can start getting x-rays pretty early on. X-rays are the primary tool that they will use to diagnose, and the diagnosis is pretty simple. It's pretty much determined just by x-rays. You can get additional imaging, but most doctors are able to diagnose this just off the x-ray alone, and will usually start you off with physical therapy and exercises from a very early age. In conclusion, as I mentioned before, this is a spinal deformity that develops during adolescence. It is most likely involves genetics, and this can cause a significant amount of back pain, which can cause some issues in daily life. Mostly managed through physical therapy, bracing, medications, and can even lead to surgery. And early diagnosis is crucial for these patients to limit the negative effects down the road.